Hello everyone, my name is Matthew Koshko, and I'm going to be talking with all of you today about students with emotional and behavioral disabilities. My presentation is titled Learning with Feelings, an in-depth look at students with emotional and behavioral disabilities. So what exactly is emotional behavioral disability? By definition, it is a student with an emotional behavioral disability that has persistent and consistent emotional and behavioral responses that adversely affect the performance in the educational environment that cannot be attributed to a specific age, culture, gender, or ethnicity. The source of this was the Florida Department of Education. What are some characteristics of students who have an emotional or behavioral disability? These characteristics include hyperactivity, such as a short attention span or impulsiveness. These students may show aggression or self-injurious behavior. These students may also seem withdrawn and deal with social anxiety or fear of being with a large group of people. These students may also show some signs of immaturity. These include inappropriate crying, tantrums, poor coping skills, etc. They may also showcase some learning difficulties or consistently academically performing under their grade level. The source of this was the Division for Emotional Behavioral Health. I'd also like to touch up on some possible causes. According to the Division of Emotional Behavioral Health, no one knows the actual cause of an emotional or behavioral disability, although several factors, including heredity, brain disorders, diet, stress, and family functioning, have been suggested and researched thoroughly. The source of this is the Division for Emotional Behavioral Health. So what are some manifestations of EBD? These could encompass generalized anxiety disorder, ADHD, depression, oppositional defiant disorder, or obsessive compulsive disorder. Source of this is from Exceptional Lives, Practice, Progress, and Dignity in Today's Schools. So how prevalent is EBD in children? According to the National Institute of Mental Health, emotional and behavioral disorders affect 10 to 15% of students annually. Minority students make up a significant number of EBD students. The source is the National Institute of Mental Health. So how do we evaluate students with EBD or students that we feel may have EBD? We have to ask ourselves some questions. Is the student able to build and maintain relationships with peers and teachers? Do you find this particular student has a difficult time relating to people? Does the student show an inability to learn, which cannot be explained by intellectual, sensory, or identifiable health factors? Does the student show inappropriate feelings or behaviors under normal circumstances? Does the student show a general pervasive mood of unhappiness or depression? These are some things that we would look out for as instructors. The source of this is, again, Exceptional Lives, Practice, Progress, and Dignity in Today's Schools. To continue on the evaluation of students with EBD, observations should be conducted from both the parents and the instructors that work with the student on a regular basis. We should also be screening the progress that these students are making. What work is being completed? Does the student do well in groups, or do they learn better when they're by themselves? Assessment. You should also provide proof of these learning difficulties. This would be especially important if we evaluate these students and we are discussing some possible IEP accommodations. Determination. We also want to provide feedback to the parents as well as other instructors in the school about the evaluation and feedback that we give the student on a regular basis. Source of this, again, Exceptional Lives, Practice, Progress, and Dignity in Today's Schools. So let's talk about some strategies for inclusion. The first strategy would be to keep the rules clear and consistent in your classroom. You want to create a list of classroom rules that are direct and easy to understand. The second strategy would be to reward positive behaviors. We want to be able to provide incentives throughout the day for positive interactions to all of our students in the classroom, not just students with EBD. We also want to offer choices. EBD students like to feel in control, and by offering small choices, a student may feel more in control. These could also be this or that choices. For example, if your student is having a difficult time staying on task for reading, you could let the student know, if you would like to, for the next 15 minutes, you can either finish up your reading assignment, or if you'd like to go over to the math area and work on some of your math assignments, you can do that too. Either way, both choices have the student doing something educational and remaining on task, but the student feels as though they're in control of their actions. We also want to utilize some motivational strategies. It's important for us to set goals for EBD students and give rewards for those who are able to reach the set attainable goals. I want to emphasize the word attainable for this one. The goals that we have set for students with EBD need to be easy to understand, attainable, and not too challenging. The source would be the Resilient Educator. So let's touch upon some Miller's 9 accommodations, or finding the appropriate ones. I listed 4 that I think would be best suited for students with EBD. First one being time. I think it's important to allow for additional time to complete activities and tests. Some EBD students get very frustrated when there's a time limit put on specific things. By allowing some extra time for them to complete assignments or tests, you're allowing them to regain control and learn at their pace. Difficulty. Match the child's skill level to the challenge of the schoolwork. As an instructor, we should always be looking at challenging our students. However, some students with EBD may have a difficult time completing work that they find too challenging. It's very important that we don't give them paperwork or assignments that they would find extremely challenging, as that could be very frustrating for them. Alternate. It's also important for us to modify our goals and outcomes and expectations with them. If you find that there is a specific goal or outcome that is too difficult for these students to meet, you may want to look at the possibility of finding ways to make it easier. Also, size. Adapt the number of items that the student is expected to learn. As I said before, EBD students can become frustrated very quickly. Therefore, minimizing the number of words they may have during a spelling test or the amount of homework that they have would greatly improve the ability for EBD students to stay on task. Source of this is autism.org's 9 domains of accommodations. So in doing my research, I looked at some similarities and differences between EBD students and ELL students. Surprisingly, there's a large number of similarities and not a lot of differences between the two types of students. For one, both EBD students and ELL students are a product of environmental causes. ELL students may come from a different country that doesn't speak general English. EBD students don't really know why they have an emotional behavioral disability. As we read in the first couple of slides, no one actually has a reason, or no one knows why they're caused. Some external symptoms are showcased for both of them. For example, EBD students may lash out in the classroom. ELL students may go internally and refuse to talk to each other. Anxiety is also included for both of them. As you can imagine, not being able to control your emotions or not being sure about how you're going to feel at any moment may cause some extreme anxiety. ELL students, by not understanding a lot of things going on around them, may also deal with anxiety. Both students may showcase a lot of internalized frustration. Not understanding what's going on around them may cause them to inwardly get upset. Both students may also avoid interactions. And both students struggle in one way or another with communication, whether it's not understanding the language that's being used or not being able to express themselves. There are some differences, although they are quite small. Both students would showcase different difficulties when it comes to reading and writing. However, I feel as though ELL students have a harder time handling reading and writing assignments. Emotional regulation is different for both students. EBD students may not be able to control their emotions, whereas ELL students usually can. Both require different accommodations. And as far as external stimulation goes, EBD students have a difficult time getting away from external stimulation and sometimes lash out because of it. ELL students aren't usually bothered by external stimulation. The source of this is the Exceptional Lives, Practice, Progress, and Dignity in Today's Schools. I also wanted to provide a list of assistive technology. These include text-to-speech software. Reading can sometimes be difficult for ELL and EBD students in general. They can also be a source of frustration. This kind of software can alleviate stress pertaining to that specific subject by translating what they are reading into words. A reminder watch is especially good for EBD students. It helps them keep a schedule and vibrates and reminds students about important daily tasks. Talk lights are a good piece of technology for the classroom in general. It reminds students if they're becoming too loud in the classroom and can further prevent behavioral outbursts. Noise-canceling headphones can also be made available to students with EBD. Overstimulation is a big issue. Headphones can help quiet down the room and prevent overstimulation. And the Ed Advocate is the source for this slide. I've also provided some resources for those who want to learn a little bit more. The first one is to help evaluate students with emotional behavioral disabilities. The next one is a link to the 9 domains of accommodations and explanations, or the Miller's 9. I've also provided a link for classroom accommodation ideas when you have an EBD student in your classroom. Also provided the list of assistive technology resources. And I also wanted to provide a link for emotional behavioral disability signs and symptoms for those that might be concerned about some students in their classroom and how to look out for them. Here's a list of my references. Thank you for watching.